Professor Bawantha Gamage, one of the surgeons who have special interest in colorectal surgery, especially laparoscopic colorectal surgery. And today I'm going to enlighten you on bowel cancers. As we all know, bowel cancer is becoming more and more frequently detected cancer in Sri Lanka. It is the fourth commonest cancer in Sri Lanka. It can affect both males and females. And we have detected patients in different types of ages, starting from my youngest patient is about 17 years and the oldest patient is in 90s. So, and since it is becoming more and more common, like in other parts of the world, in developed countries, they have bowel cancer screening program, and I think it is high time for us to start a screening program, at least in high-risk patients. Now, there are many tests that we can do to detect bowel cancers, more importantly, pre-malignant conditions. That is, before a cancer develops, there are precancerous states, precancerous stages like polyps, ulcers. So before they become malignant, we can detect them. For example, in UK, they are doing now bowel cancer as a part of bowel cancer screening. They recommend to do what is known as flexible sigmoidoscopy or screening colonoscopies. Earlier, the people, they used to do what is known as fecal occult blood. It is just to detect blood passing without your notice. It can easily be done in Sri Lanka. More sensitive and specific tests are called FIT tests or fecal immunohistochemistry assays. Or in addition, you can also detect polyps and ulcers by doing flexible sigmoidoscopies and colonoscopies. So about 70% of bowel cancers occur in the left side of the colon and in the rectum. Therefore, by doing a simple camera test like flexible sigmoidoscopy, you can detect about 70% of bowel cancers or precancerous lesions. And if you are a high-risk patient, or if you are more than 50 years of age, if you have a family history of bowel cancers, then it is always recommended to do a bowel cancer screening test. And once a pre-malignant disease is detected, for example, a polyp is detected, then and there you can treat that polyp by doing a sigmoidoscopy or colonoscopy, and then you can remove the polyp. Unfortunately, if a patient was detected to have bowel cancer, it is always important to detect these cancers as early as possible. If you detect the bowel cancers in early stages, it is 100% curable. Therefore, I recommend you to present yourself to a qualified doctor and find out whether you are a high-risk patient, whether you have symptoms of early bowel cancer. If you have those symptoms, or if you are a high-risk patient, then it is recommended to get the screening test done to exclude bowel cancer or pre-malignant states.
Lanka Hospitals. Caring, curing.